I never in a bazillion years pictured, yeah, okay. So, hospice. Some of you have had experience with, some not, I am sure. Okay, so our hospice is based up in Fargo. We have satellite offices throughout, Detroit Lakes being one of them, Lisbon, Valley City, Mayville, Grand Forks, Thief River, blah, blah, blah. So we cover 2 states.
Wow, you're busy.
We're pretty big.
Well, I guess so.
So, we're non-for-profit, and what we do is we provide comfort and support to patients and their families during an end-of-life progression. When the doctors say you have 6 months or less, there's nothing more we can do, go home, be comfortable with your family. That's what we do. Okay?
Well, no, I don't. Nobody told me all this.
Yeah.
I mean.
Well, that's why I'm here. Okay? We don't do anything aggressive. We don't do anything life-sustaining. We simply keep you comfortable while the disease takes its course.
Oh.
Whatever disease it is.
Old age?
Old age is sometimes it. Okay?
Right.
Okay? So, Medicare says that they need to kind of put a time frame, because we need to get both your regular doctors okay, as well as our medical directors okay. It's a Medicare safety check that nobody is being fraudulent about hospice care, billing inappropriately, blah, blah, blah. Okay? Medicare also puts a time frame of 6 months or less. Okay? And they put that out there because many, many years ago, people would be on hospice for years.
Yeah, I do.
And it costs a lot of money, and Medicare finally just said, 6 months is more appropriate. With that being said, we have had patients on service for less than a day and for more than 3 years. Okay? So that 6 month isn't okay, you hit the 6 month date, we're going to kick you off service. That's not what's going to happen. What happens is when somebody comes onto our service at the 90-day mark, the 180-day mark, and then every 2 months thereafter we go through what's called a recertification process. And that's basically us showing Medicare that she's still appropriate for services, that you still qualify for what we're doing, okay? There are some circumstances where the patients get better. They start to gain weight, they start to walk, they're looking better, and we say, you may not be appropriate for what we do. Maybe home health would be more appropriate. It does happen every now and then, but generally not.
My God, you're getting warm.
I know. See, I got close to you. So that's kind of what happens.
Hi, JC.
I
can kind of see you over there.
Want your glasses on?
You keep going. Okay. At the 180-day mark, doctor also comes out and does a face-to-face visit, and every 60 days thereafter, every 2 months.
Well, I haven't even been to the doctor.
Well, she's going to come to you.
Why, doctor?
No, our doctor.
In 180 days. You got nothing to worry about. You're going to go in the morning, remember?
I have to do what?
Nothing. Lay there and be pretty.
I have to be at the church, yeah.
There's one thing, Leslie, we shake our family tree, a bunch of nuts will fall out.
Yeah. She knows.
Still shakes a little bit.
She was one of those nuts for a while.
So we talked about that. Many people associate hospice with cancer, with death, which cancer is one of the diagnoses we serve, but people die from everything all the time, whether it's heart failure, kidney failure, liver failure, Alzheimer's, dementia, Lou Gehrig's, Parkinson's. There's multiples, different things, so it's not just cancer.
I think it's just plain old age.
Yep, and sometimes that's it. And
86.
86 years young.
Very.
Okay.
You want me to doctor for you?
And a lot of people will come and, you say the word hospice and they think death. We try not to focus on that. We're not going to come in all doom gloom, we're gonna come in, we're gonna talk about the weather, we're gonna joke, we're gonna point, you know, we
Yeah,
the point of what we do is to keep you comfortable so you can enjoy whatever time is left. Whether it's 1 day, 5 days, 5 months, whatever's left. Okay?
okay.
Okay. So that kind of covers pretty much all of that. Now when it comes down to the hospice team, we have our medical director in Fargo. Her primary objective is that she is available 24/7, 365. So if there's crisis at 2 a.m. on a Saturday morning, I'll be able to call her and she's going to say, Leslie, this is what I want you to do, and I'm going to be able to implement that right away. We don't need to go to the emergency room. We don't need to go to the doctor. We're going to handle everything right here.
Good.
Okay?
And
When you...
Doctor, who do I want to come? Doctor who?
They have a doctor
I
through
know,
hospice.
but I
Well, and our doctor doesn't come, we just do it through us, yeah. So when a patient gets admitted to services, we order what's called a comfort kit, including medications to keep you comfortable. Sometimes that bag goes up into the cupboard, we never have to use it, we never have to touch it. Sometimes within a day it's pulled down and we're starting to use those medications. Those medications
Well, I
commonly...
don't really hurt nowhere.
No, but that can change any time. And much like tonight, I would rather have the medications here and not need them than not here and need them, because that's tough. Okay, so we order morphine for breathing and for pain, depending on your allergies, of course.
She's not allergic to
Anything?
But
Okay,
penicillin.
lorazepam for anxiety and breathing, ondansetron for nausea, vomiting, and then glycopyrrolate for secretions. We're end of life, the death rattle. Okay.
Do they
Again,
have anything for all the spit? And the mucus that comes off?
Mucinex. Has she been taking any Mucinex or Robitussin?
No.
Well, okay. You could take some cough syrup for that. It'll loosen it up, and that way you can cough it out easier.
It's good.
She won't take anything.
Surprise, surprise.
Well, I just don't think, I don't know what's going on half the time. Last couple days.
Okay.
I heard my 80-degree law's going, so I gotta stay awake, or I don't think I'll make it.
Medical director also does. We meet every 2 weeks when what we call an IDT. We roundtable every patient we have. The doctor, our clinical manager, the nurses, the social workers, chaplains, volunteer specialists, and bereavement volunteer coordinator and bereavement specialists. We make sure that on a holistic level we're meeting the patient's needs all the way through and through. Okay? Then the medical director also comes out at that 6-month time frame and
You
does that
listening
face
to
to
this? I
face.
don't hear it all.
Yeah, they're listening. I'm trying to talk loud, but I don't want to feel like I'm shouting in your
No,
ear.
It
You won't
doesn't
hear it
matter.
anyway.
Can't hear the other one.
Okay.
Except from one ear.
The medical director does do a lot more than that backstage, but for all intents and purposes, for the patient and the family, that is what she does. Okay.
Who's way over there?
Raimi.
Raimi.
I gotta get my glasses on.
Okay. They're right here. Do you want
No,
them?
I don't.
Okay.
But it's good to see you, all your little babies. Oh,
My
girl.
little babies, I have a grandbaby now.
You
I do. He is so cute.
A boy or a girl?
A little boy.
Oh. Oh.
I've got a picture on my computer. If you're still awake when we finish
Oh.
up, I'll pull it up.
You do that.
I will.
How old is he?
He's 1.5 years.
Holy.
Tell her it's Charlene.
It's Charlene's son.
Yeah.
Yep. She's married and she lives in Denver.
Oh my God, so far away.
I know.
He's in the service.
Marines. Mm-hmm. Yep. Okay, back to back to hospice. So the nurses, on average, come once a week. More often if needed, less often if not. Okay, we have
But
some.
what if I don't need him?
I think you're gonna need them.
They come anyway.
You gonna help me die?
No, we don't do anything to hasten or prolong. We
Oh.
just let things go and we keep you comfortable.
Good.
Okay. On average, once a week, more often if needed, less often if not. We have some patients that are really mobile yet going and doing, and they're like, I'm going to go deer hunting this weekend. I'll see you next week. Deer hunting, I'll see you next week. But as things change and progress and there's more need, we may be visiting more often versus not. Okay. We have our on-call nurses like myself. So after hours and on the weekends, Monday through Friday from 7 to 6, when you call our 800 number, you're going to get the call center in Fargo. They will try to talk you through whatever is going on the phone, symptom manage that way. If a nurse visit is needed, they're going to dispatch a nurse. After hours and on the weekends, then you call an answering service. It's the same phone number, but you get an answering service. They call me, and then I call you back, much like it was this weekend.
Yeah, scratch
And I
my
did
thumb.
relay that your concern to my
It
clinic
itches.
manager, and I put the name in there.
I still can feel.
Maybe you should have went to Monoman with me.
They chased you out of the door, but there was not good.
And that's nurses. So we are available 24/7. The only time we won't come make a visit is if the roads are closed or the travel is that bad that we get out on the road and we say, yeah, we're not. This isn't worth it. Then we have our CNAs. The CNAs can come help with bathing, dressing, grooming, hair, nails, massage, Up
Yeah,
to-
you gotta talk to you.
Up to what?
up to
He had to
50
give-
minutes
he had
per
to give
day
me my-
based on the patient need.
He shampooed my
Okay.
hair this morning. He did.
First time in 50 years?
Yeah. I got to sack them up too.
All right.
Yeah. That's a little different. So I done sacking.
Not used to that sacking up thing.
You sure have a special family.
I do. They're the best to win.
Okay, so we talked about nursing. Okay, then we have social work and chaplain. On average, they come 2 to 4 times a month, so not quite as frequently as the nurse, but they are still there, again, as frequently as the patient needs. And the social worker is there for power of attorney, advance directives, that kind of paperwork if you need help with, and sometimes just emotional support, listening, and just being present. Chaplain is more spiritual, of course, with prayer, hymns, scripture. She's non-denominational, and she can collaborate with your home parish if you so want her to.
I haven't even got a preacher to preach at my funeral.
Our hospice chaplain has been known to do that. So,
Listen to them.
okay.
Who do you want to preach?
I know it, you're the preacher. You didn't have to get up.
You can
and give your
record
own
ahead of
sermon.
time.
There you go.
Maybe I can deliver it then. Maybe I'll ride up in with it.
Then we have our volunteers. The volunteers can't do any hands-on care, can't give you medications, do anything like that, but they're there for just companionship. So wheelchair ride, reading a book, playing cards, having coffee, that kind of stuff. That's what they're there for. Okay? Then lastly, we have the bereavement specialist, and that person would follow up with the family afterwards for up to 13 months to make sure everybody's doing okay.
Oh, Christ, don't talk 13 months. 13 minutes.
Okay. So that is our team in a nutshell. Okay,
You
person.
got a good team. I have never heard anything bad about it.
Yep. Okay. The next thing. Any questions on any of that so far? Anybody?
I don't have any.
Nope. Okay.
Itchy fingers.
You're allergic to me.
You're cool.
Okay. Paying for hospice care. I'm assuming you got Medicare, Shirley?
We got it.